Well, Dr. Dayo Ajibade is a medical doctor, a health educator, and founder of Brain and Body Foundation. He joins us live from our Abuja studio to discuss some of the latest developments in the nation's fight against COVID-19. Good afternoon, and thank you for joining us.
Hi.
Well, Dr. Ajibade, the pictures coming in from Ekiti State, let's start with that, is quite worrisome. And clearly, it appears as though we have a long way to go in sensitizing people, especially at the rural areas.
Yes, it is a big problem. I traveled recently to one of the northern states around here, and almost no one, in fact, no one except me and the person I went to see were wearing masks. And I mean, you see them in their large numbers. So it is a challenge. Of course, part of it is because of the cultural beliefs. Others simply don't believe it exists. They think it's some kind of propaganda. And others just believe that it's not going to happen to them. So there's still that challenge of being able to convince people the reality and the seriousness of the situation. So it's still a big challenge.
You know, yesterday the PTF pointed out that messaging and consultations will continue. In fact, that was one of the key messages at yesterday's briefing. So what model do you think we can adopt in passing this message across to those who hold, for example, primordial sentiments very strongly?
We need to go through the existing authority lines, the chieftains, the emirs, the local leaders, go through the radio waves, the formats in which the individual communities the individuals in the communities can respond to. Simply on TV alone may not always be able to pass the message across, and so there has to be that more extended grassroots approach so that people can really understand it. In addition, people need to understand the severity of the condition. Maybe even showing some graphic pictures or showing how people like them have died from the disease, because I think that's really what gets to people. Just talking about COVID-19 to many locals may not really have the impact that it needs. So I think there has to be more aggressive grassroots mobilization.
Well, we'll talk about Nigeria's latest figures in a moment, but the PTF also referred to the recent political campaigns in Edo State. I'm sure you've seen visuals coming in from Edo State, from both major, the main party and the opposition party. You see people, disregarding physical distancing, not wearing face masks. Is there really a solution to that one?
It's hard to get. It's sometimes really difficult to get through to people. We need to not relent from all the activities of trying to get the information across. But in addition, I would also say, in addition to the non-pharmaceutical methods of face masks and social distancing, people need to understand how to strengthen their immune systems. And this is something that is talked about a lot. We know now in retrospect that vitamin D, they found out that the most severe cases and the ones that die, the ones that result in death, they all have this in common. They have low vitamin D levels. So I think that would be a start to also educate people about some of these other non-pharmaceutical methods, so that, not as an excuse, they still have to wear masks and they still have to social distance, but they need to also be able to take care of themselves and their families, just in case they're not able to get to an isolation center in time, or not be able to get a treatment center in time. So they need to be able to protect themselves and their families by using some of these things we have found out in the last few months that can help in the fight against COVID-19.
It's been long 5 months of this battle, but, Nigeria recorded 290 cases yesterday, which is our lowest in a while. But when you hear the SGF, for example, say that for every case detected, there may be 7 other cases that we missed. So how should we handle these low figures, for example?
Some say it's about as much as 10 times the numbers that is the reality. Some say as much as 50 times in other countries. So I personally still believe we as Nigerians in Nigeria are much more fortunate than the Western world. It certainly has not been as severe in this part of the world than others. However, that should not be a reason for us to relax. We should take the numbers. They are still numbers, and the proportions are still pretty accurate. And we know that 80% of people who get the disease or who are tested will have minor to moderate to minor illnesses, and they'll come out of it. The problem is that these people can spread the disease to those who are elderly and more immunocompromised or more susceptible, and that can be what kills them. So it doesn't matter how low the numbers are. We need to always be aware that it's not just for ourselves we're protecting ourselves. We're taking these measures. It's also for those who are more vulnerable, like the elderly, the obese, those with hypertension, those with cardiovascular disease. That's extremely important, and we've lost quite a few people because we thought it was not as dangerous as the media has put it out to be.
Well, I'd like to thank you so much, Dr. Dayo Ajibade, a medical doctor, a health educator. He's also the founder of Brain and Body Foundation. Thank you for your thoughts this afternoon.
Thank you so much for having me.
Well, has Russia developed the vaccine for COVID-19? Well, the government certainly thinks so, but we'll bring you other angles after the break. Please stay with us.